Hi guys, welcome to the platform of DS Civil Services. In this video, we will be discussing about Ebola virus disease, which was recently in news because World Health Organizations WHO declared Ebola as an outbreak in the country of Congo, along with that in Uganda. Also, WHO declared this as a PHEIC. What is PHEIC? We will see in the video uh, after some times, and also we will see what are its symptoms and all the related things regarding Ebola. Let's see. Ebola, it was declared as an outbreak in 2026 itself. What is the meaning of outbreaks? So, outbreak is the first stage wherein WHO declares any disease like this is our first stage and this is the contaminated area. So this is the first stage over which the WHO declared that area as a initial area of that disease. So this is a initial area. It is not a country, it is just an area or a region. After that, there is another important stage. You can call that as a second stage, which is epidemic. Epidemic. Just give me a second. In epidemic, what happens? This is spread over the entire country or a bigger area. Country or a number of countries or a bigger area. So after epidemic, there is a third stage and it's the last stage, which is pandemic. And in pandemic, like you know, COVID-19 was a pandemic and it is a global, at the worldwide level. Worldwide. So these are the stages in which WHO declares any disease as an outbreak, epidemic, pandemic. So you need to remember these. What is outbreak? What is epidemic? What is pandemic? Just a little bit of introduction. That's it. Next thing we'll see that this was Bundi Bugyo outbreak. So Bundi Bugyo virus disease. It was actually called as BVD disease, and it was declared as an outbreak by the World Health Organizations. What is PHEIC status which was given to this BVD outbreak? PHEIC means public health emergency of international concerns. Public health emergency of international concern. That this public health emergency does have a international concerns. Whenever World Health Organization declare this or any disease as a PHEIC status, that means this requires a higher level of global health alert, not only in that continent like Africa, but at the global level. And this also, it has happened the same. So that means the WHO has already mentioned to all the country out there that there is an outbreak which is going on and we need to focus where on international borders, so that we can spread or the contamination of this disease. Okay, so where was the region it was found? It was found in Ituri, DRC. It is this one is a Democratic Republic of Congo, DRC, this one, and this is Uganda. So in two regions, Uganda and DRC, these were the two regions where this outbreak was found. What was the impact? Over 500 suspected cases has been found and 130 deaths have been reported. So for the exam purposes, what we have to remember: what is outbreak, what is epidemic, what is pandemic? Three things. Fourth thing, what is BVD? It is just a virus disease which was in news because of Ebola virus. It is a part of Ebola virus only. It was declared as a PHEIC status. By whom? You can get the questions like who declares the PHEI status, that is WHO. What is PHEI status? It is nothing, just an alert at the global level for the global health. which declares formally for an extraordinary disease outbreak or a health crisis. All right. So it is nothing but just a caution to all the countries out there. Third thing, what was the impact? It was having an impact of 500 plus suspected cases and 130 plus deaths as well. So what was the significance of this? So this was a 17th recorded outbreak in DRC since 1976. So 1976 was the time where it was started in DRC, in Democratic Republic of Congo, and after that this is the 17th of the time that it has been recorded over that region. So of course it is a concern of for not only the DRC but all the countries out here. Next we'll see it's a pathogen, and what about the transmission biology. So talking about the pathogen, ebola ebola, it is classified as a biosafety level 4 BSL 4 pathogen. Remember this name, that ebola, it is classified as BSL 4 or biosafety level. Bio, see the name, bio means the biological levels, safety concerns, and the level, like to which level it is getting stored, what are the stages of its storation. So that is for this one. For ebola, it is a BSL-4 pathogen. What happens, what is the meaning of this? That it is among the world most dangerous viruses, amongst the most dangerous viruses. What happens in highest hazards groups requires maximum contaminant, which means it requires a positive pressure suits like this one. You can see in the image that it should not be get inside the body of the one who is researching on the group on the ebola virus. So these requires a positive pressure groups, also the airlocks, and also the HEPA filtrations. So these are the terminologies which is related with the BSL-4 classification, nothing else. Talking about the transmission, how it is getting transmitted, how it get spread through. Okay, so it is having a direct contact, direct contact. It is having a direct contact. So contact with bodily fluids such as bloods, vomiting or vomit, feces, sweat, semen, urine. So also the breast milk. Along with this, the infected persons. This is of the infected person. You will see this can be spread also with the used needles of the person to whom that needle must have been used to the treatment of the diseased person. Along with that, it can be also spread via clothes, also the beating. So these are the transmissions or spreads which can be seen. So we have to be very cautious. In India also, we can see recently the Indian government has declared or has cautioned the international airports, also the seaports, that be cautious regarding the health of the intruders who are coming inside the country regarding the ebola viruses transmissions. All right, this is a zoonotic vector, which means, what is the meaning of zoonotic? It is spread via animal. Zoonotic means it is spread via animal. So fruit bat is a natural reservoir of this disease of ebola virus. Next we'll see What is the reservoir? Reservoir means who actually or who naturally spreads it. So fruit bats, they are primary animals which carries for the viruses. All right. Bush meat, so that is the raw and uncooked meat from the apes, along with that monkeys and forest antelopes, is on high risk. So whomsoever who take this raw or uncooked meat from the apes, from the monkeys, and forest antelopes is on the high risk. All right. Next, what is the warning? It is to avoid any contact or any direct contact with the sick or the dead wildlife to prevent the spillover. So, to prevent the spillovers, we should not come into the direct contact with whom? With the sick person or with the dead bodies of the wildlife, especially whom? The apes, the monkeys, or the forest antelopes, which are at the very high risks for this Ebola virus outbreak. Next, we'll see also. So it was started in 2000. It was on the peak in 2014 to 2016. It was declared as an epidemic. We have seen the outbreak. We have also seen what was the meaning of outbreak and who declared these statuses. After that, we have epidemic, and after that, we have a pandemic. See, okay, OEP. Remember this. It has been declared by the World Health Organization. What else? WHO declares PHEIC. It is also being declared by the. It is a level of basically a kind of risk and a caution to all the world countries. Now, it was declared in 2014-16 as an epidemic in entire this regions, along with that in DRC also, Democratic Republic of Congo, and in Uganda also. Over here, you will see the Uganda. Okay, so this is an Atlantic Ocean. This one. Okay, so this was the largest Ebola outbreak in the history occurred in the Western Africa, like Guinea, Liberia, Sierra Leone. These are the areas. Also Mali, Niger, Nigeria, Ghana, Ivory Coast, Liberia, Togo, Benin. These are the area where it was spread. Total impacted was 28,600 plus cases and 11,310 plus deaths were recorded at that time. What were the key lessons? That rapid urbanizations allows for the explosive transmissions. Rapid urbanizations means rural people moving to the urban areas rapidly. So this allows for explosive transmissions. It has increased the transmissions. Okay. Second, global impact. It reached the major international transport hubs also. Next, the prevention and vaccinations. Give me a second. Talking about its preventions and the vaccinations. Preventions, how it can be prevented. So what we have to do, we have to stop the direct contact. No direct contact. How? We have also maintained the, we need to maintain the hygiene we have to maintain, right? We have to stop the infection controls, like strict use of personal protective equipments, like the healthcare suits also. We have to be very cautious in using them. We need not to use the used needle also. No used needles. Also the infection controls like suits. Okay. Also we have to bury the dead bodies of the one who has been deceased by the infected viruses. We have to safely bury those bodies. Safe burials. Safe burials, avoiding the direct contact with the bodies of the people who died because of EVD, Ebola virus disease. All right. Also, we have to make the ring vaccinations strategy. It is a kind of vaccinating all the close contact of a confirmed case. So, like suppose if I am the one who is been impacted by Ebola virus, EVD, okay, what will happen? What this ring vaccination says, so whomsoever was in my close contact will also be shielded, or the immunity will be provided to those also. And those people, all those people, like suppose if I have a person X, I have a person direct contact with Y, Z, so these will also be vaccinated. Okay, so this is making a ring vaccination so that this contaminations of EVD cannot be spread outside. So this is very important, targeting contacts to create an immunity shield. What are the vaccines available? The very first vaccine is Avibo. Avibo is a single dose vaccine used in outbreaks. So especially at the time of outbreaks, this Avibo vaccine is used. In the case of this virus, which is recently in news, which was in which was declared by World Health Organizations, the same things will be applied. Next vaccine is for Ebola. It is Jabdino or Mvabia. Zabdino and Mvabia, these two have a two-dose strategy. So for Avibo, there's only one dose vaccine used in the outbreaks, and Zabdino and Mvabia, there are two-dose strategies. Now we'll see like what are the major species of Africa where this Ebola virus is seen. So species like Zaire Ebola virus, it is seen as a most deadly as a most outbreak areas. Next, you will see in Sudan Ebola virus. Sudan, this is Sudan over here. This is Sudan. South Sudan as well as in Uganda, focal points of this Sudan Ebola virus. Bundugyo, this one which is in news in 2026, especially in DRC and in Uganda. DRC over here, Democratic Republic of Congo, and Uganda over here. Okay, you can see, I hope. And this one is Sudan. Thai forest. Thai forest is a rare one, and this is found in the Ivory Coast region of the Africa, over this region. Bombali. Bombali is identified in Sierra Leone bats. So Sierra Leone bats are the one where this Bombali species is being identified. So you can remember these names if in PY in MCQs type questions. If UPSC or UPPCS does ask such kind of questions, you can remember this and you can match the following. That's it. Next, what is the preventions and the diagnosis summaries? So community measures, what can be the community measures? Like safe burials that we have already seen, no touching. We also have to maintain the hygiene, hand washings, strict PPE in clinics. So in clinics, we have to maintain the strict PPE. Also, what is the diagnosis? This is the RT-PCR testing, okay, on blood sample. So we have to do a RT-PCR blood testing also. This is the gold standard for the case confirmations, like whether the case is being confirmed, whether the person is being infected or not. So these kind of strategies we have to follow in this one. One last thing to see over here, it is regarding the Ebola virus, why it is dangerous. Question mark, why it is dangerous. So there are a few points, like the very first part is it has a high fatality rate. High, remember this is having the high, give me a second. This is a high fatality rate, which means the death rate. So suppose if any area this is being found as initiated, you will see as a high fatality rate. High fatality rate. It is about 25% to 90%. So from 25%, like suppose 100 people are infected in a region, in DRC, in Democratic Republic of Congo, and out of 100, it is possible there might be 25 people which can be dead, or might be 90 people. So this is very dangerous. Second thing, it causes severe dehydration in the body. Severe dehydration. So need of what requires? Liquid requires. You have to, the infected person should drink the water as much as they can, especially the glucose water. Also, it causes the bleeding. Causes the bleeding. There is one more thing. Why it is considered to be dangerous in this, the lack of early symptom specialty. You cannot see the early symptoms early, as soon as possible. So that absence does causes the fertility rate, and it does increase the fertility rate as well. So lack of early symptoms specialty specific. And also along with that, there is a limited infrastructure in, if we talk about Africa, there is a limited infrastructure, limited healthcare facilities, right? So these are all the reasons this outbreak was declared by the World Health Organizations. Although it does not have a very simple cure, but with the gentle of treatment, there will be a good survival of, there is there the survival chances will be improved for this one. Okay, so this is all about this Ebola outbreak. I hope you like the video. If you do like it, please subscribe the channel and share with your friends. And I will be sharing this PDF in on my Telegram channel, and I will attach the link of the Telegram channel below the video. Thank you so much for your patience. Have a good day. Bye bye. Take care.